Hello and welcome to Talk on Nevada. I'm your host, Andy Matthews. And joining me this week, once again, is Geoffrey Lawrence, fiscal policy analyst at the Nevada Policy Research Institute. Jeff, welcome back.
Thanks, Andy. It's great to be here.
Well, I want to focus this week on what seems to be a really big issue on everybody's mind, and that is healthcare. The president this week has given a big speech on healthcare, sort of outlined his vision for healthcare policy. In a nutshell, tell us about Obamacare and the Obama plan on healthcare. What is it? What does it do?
Well, Obamacare is basically socialized medicine light, or socialized medicine that will take a while to kick in. He wants to create a so-called public option that is, a taxpayer-subsidized form of health insurance that will compete with private healthcare providers, and it's probably going to create it's going to create increased competition and pressure on those private healthcare providers. But because private providers have to pay taxes, comply with state mandates and so forth, and that they have a little less flexibility than the so-called public option will, and it's probably going to force a lot of those companies out of business.
So if you're a private insurer today, you're probably feeling like the deck is starting to be kind of stacked against you.
Well, yeah, that's true. I mean, that's really what's happening. It's kind of like if you look at the public option versus private healthcare providers, it's kind of like two teams playing against each other, except that the government is now not only one of the teams, but they're also the referee and the scorekeeper. So it's a rigged game.
Well, most folks out there, they're not going to be so concerned. Well, what is the impact going to be on private insurers? They want to know, how is this going to affect me? Mm-hmm. Give us the bottom line on that. I mean, if you're a citizen in Nevada or anywhere else in the United States, what should be your concerns about the direction that healthcare is heading, and given the Obama plan?
With private companies basically going out of the game, the immediate impact is that consumers are going to have fewer options available. You basically have the government healthcare plan or the government healthcare plan, and it's all the same thing. You can't. You have very little flexibility to choose different levels of care that are appropriate to your specific condition. For example, for very young individuals who are generally healthy, they may, if they have the choice to, opt to go with a higher premium insurance rate or something like that, but they'll have fewer options available to do that. So it's basically the government is hijacking their spending decisions, just reaching in their wallets and taking their money and deciding what to buy with it.
So basically, under the cover of introducing this new public option, basically government is, surprise, going to be decreasing the number of options we actually have. What do we do about healthcare? I mean, certainly there are some inefficiencies, some problems with the way it's currently structured. Should we just leave the healthcare system the way it is?
No, I think it's clear that the healthcare system needs reform, and it's not that those who oppose the Obamacare plan don't recognize that. In fact, we have our own ideas for reform. What I see from the Obamacare plan is that it's not really a solution, because it will create more problems than it actually addresses. It's a rationing scheme for healthcare, and it'll basically there's going to be this new division that's created within the Federal Department of Health and Human Services that will politically determine which forms of healthcare individuals are able to receive, and those will be politically driven decisions and not medically driven decisions. So the quality of healthcare could deteriorate dramatically. If you look at in some of these European countries that have, or in Canada where they have a single payer system, for instance, it's very difficult to get a doctor's appointment when you need it because healthcare is being rationed. So if you have a relatively minor illness that could become a lot, if you could improve very quickly over a matter of days, if you can get treatment, and you're unable to, you could go 3 or 4 weeks generally without getting an appointment, and that disease continues to deteriorate. So then it not only becomes more costly to treat the person, but that person also has to suffer during that time period. So we want to create a system that provides more flexibility, not less flexibility, and that option is to tie health insurance to the individual and not to his job. currently the way our healthcare system is structured, because if an employer provides your healthcare program,
you lose your job, and then
well, if you lose your job, then you don't have insurance, we get our insurance through our employer because they have tax provision that makes it tax free. If instead you were to tie that tax free provision to private individuals as a deduction on their taxes when they for purchasing insurance, then you would generate a lot more flexibility. You would give people choices in the market about what type of healthcare is appropriate to their specific situation.
It certainly is peculiar that we think of healthcare as something that ought to be naturally tied to employment, where something like car insurance, it's not the case. And I think you raise a good point that we ought to probably tie it to the individual rather than to employment. In terms of where this is going, certainly we know where the president stands. We know that given the balance of power in Congress, Democrats controlling both chambers, that this type of a plan is something that they've had on their agenda really for decades now. Mm-hmm. Is this a done deal, or is there any chance that we could end up with a better alternative from a free market viewpoint?
Well, it seems clear at this point that the Democrats are pushing very hard this year to get this type of system through. Although I think the estimated cost of the program is giving some people pause. The Congressional Budget Office estimated, for instance, that over the next 10 years, this program would cost in excess of $1 trillion. And we're not talking billions; we're talking trillions. So that's a huge amount. Actually, some independent estimates have been as high as $4 trillion. So you're talking about a lot of money, and at the same time, you're probably talking about a diminished quality of healthcare too, because basically it would be comparable to say Medicare or Medicaid level treatment, which is kind of it's second-rate treatment. It's like it's like back of the bus treatment almost, and their solution is not to move those people at the back of the bus up to the front. It's to move everyone to the back of the bus, which is not going to improve healthcare in the United States at all.
Making things equal by bringing everybody down.
Uh-huh.
Certainly something we'll want to keep an eye on. It's going to be interesting to see how it plays out. We are going to have to leave it at that for this week, but we'll have you back and talk about this as it unfolds. Thanks very much, Jeff.
It's good to be here, Andy.
And thanks to all of you for tuning into this week's edition of Talk on Nevada. We'll see you next week. I want to remind you to check us out on the web, npri.org, for more information on this topic and other private solutions to public challenges facing our Silver State. We'll see you next time.